The second wave of the coronavirus pandemic in India, apocalyptic to say the least, and for a change there are no other words that can describe the enormity and gravity of what's happening around us. But should we be surprised? I don't think so. Some of the models had actually predicted this eventuality very early on in the pandemic. And India's overall capacity in healthcare has never been a secret to any of us. Also, our propensity to play down a crisis has not been a secret for a while now. What has been surprising, therefore, is the enormous data and information cover-up which could have informed our way forward after the first wave hit us. Transparency in data and an ear out for hard scientific evidence as it was evolving, rather than unproven, unscientific narrative, has become the bane of this country. If we did not propagate theories about the innate Indian immunity or use of certain inconsequential drugs or even plasma therapy, and declared a victory over the virus when numbers were ebbing, if we did not hold massive election rallies and religious festivities plonk in the middle of a raging pandemic, we wouldn't have slid into this kind of complacency. Instead, if we informed our policies with data at hand that wasn't buried under layers of secrecy, if we listened to our scientists, our virologists, our epidemiologists, our modelers, instead of shutting them out of the conversation totally, we would be able to handle this better at a more granular level and answer these niggling questions better. Which region is most vulnerable? How much are we sequencing for the new variants that we see now in India? Will vaccines actually work against these new variants? Will there be a third wave? These questions can come from hardcore science and not from really wishful thinking of some sort. And we knew all of this all along. So why are people angry suddenly and angry now? That's because death and disease are a household thing today. They are not something happening to somebody else in a faraway land. Almost everybody knows somebody who has either died or is infected or is gasping for oxygen. And I recall telling my friends and peers that we are in a season of condolences. Not a single day passes by since I have said, consoled a family member, a friend or a peer, and I'm sure it's a case with everyone else around me. Caregiving, hospitalization, oxygen, remdesivir, these are becoming household discussions today. What's the way forward for us from here? Vaccination at a massive scale, and we know there are challenges regarding manufacture and supply and rollout and all of that, but one hopes that the rollout is smooth and at a scale that we can be proud of. We did very well with the immunization program thus far in the drive, but it has to go up several folds to really break the chain of infection. At the same time, sequencing for the new variants must be done at a great speed for us to understand the mutations and their effects on populations, and of course to guide also the immunization program going forward.